like to introduce the Deputy Director of the Rhode Island Department of Health, Seema Dixit.
Thank you, Riley. Good morning. It's a great pleasure to be with you, all of you here. There's few times in a year, in a month, that we have this enthusiastic opportunity to be in the community versus doing the bureaucratic work that we do every day in the office, and I always look forward to that. I was here last year as well, and this seems to be one of the most interesting events where we actually see how far we have come and how far along we still need to go, despite all the work that we've been doing. So, a great day overall. My name is Seema Dixit. I'm one of the 2 Deputy Directors at the Rhode Island Department of Health, and I'm here representing Dr. Vandy, who is the Interim Director at the Rhode Island Department of Health, who could not be here. She sends her regards and best wishes for this important initiative. I'd like to recognize Senator Jack Reed, Attorney General under Peter Nerona, and Dr. Hoffman, not just for all their support, but just for the leadership that they have provided on this important initiative for years. I think we have done great strides in public health and in lead in the state, with our senators always backing us up, providing the leadership that is needed, whether it's our funding, whether it's to be that voice that support us, or to help us create a smooth pathway in the community to do this work, and it's very much recognized and appreciated. I also have to give a huge shout out to the lead poisoning prevention staff at the Rhode Island Department of Health. You guys work very hard and you are all amazing, so big shout out. Whether it is in the evenings when we have a lead poison case that comes along and we are notified of it, or whether it's the super clean, being in the community, whatever the weather may be, to make those site visits and inspections and ensure that care is coordinated. It's hard work. It's work that often is not appreciated, and we're very grateful for it. Thank you. Essential to our success as a team is the commitment of our cross-sector partners. We never do our work alone. We are the primary funding source and own primacy for several areas in the state, but our work is actually implemented thanks to the collaboration with our diverse community partners who actually help us connect the dots outside of RIDO. So I would like to thank the Housing Resource Commission, the Core City Lead Coordination Coalition, Childhood Lead Action Project, Rhode Island Housing, Housing Works Rhode Island Alliance for Healthy Housing, and the municipality and the local leadership throughout the state. Can we have a round of applause for all of our partners? The Rhode Island Department of Health's environmental lead and lead hazard mitigation teams are the ones who are the daily boots on the ground, who diligently assist families, healthcare professionals, realtors, property owners in preventing and addressing lead exposure as an important public health issue day in, day out. Before we get started, I wanted to set the framework for today's summit. Our goal is to eliminate childhood lead poisoning. It's interesting because when we bring it up in a non-public health group or within people who are not as aware or educated, they always ask, we still have lead poisoning? Oh, is that still an issue? When we go to national conferences, summits, or meetings, we are often applauded for all the great work we do, but Providence and a few cities in Rhode Island also are noticed as one of those cities in the country that have significant old housing and as such significant lead poisoning issues. So each day, many people in this room do their part to prevent exposure to lead, which is becoming increasingly challenging. Not only do we have old housing in the state, we are also now discovering lead as a contaminant in several products, because we were all focused on the windows and the paints and all of that. Now we are discovering, the most recent last year was the applesauce and other issues. So this work is becoming increasingly critical to make people aware, to get the children screened, and to do mitigation as soon as we find out, to make it, to prevent it as well as take care of it right away. Primary poisoning prevention policies have contributed to a reduction of poisoning rate among Rhode Island's children. As a result now, we do see often people asking if it's still an issue and how far along we have come and why we need to keep doing the work we do. Our state has many tools needed to succeed in further reducing our childhood lead poisoning rates. I'm excited and I'm aware and I look forward to the continued partnerships, new relationships and partnerships and collaborations, and continued efforts of everyone in this room to make a significant impact and to keep making us get closer to this goal of eliminating lead poisoning overall in the state. At the Department of Health, we are very, very much appreciative and enthusiastic of this partnership and collaboration and public health effort that we actually use as an example between the Attorney General's office, our senators backing us up, a significant number of community agencies and community partners jointly working with the Rhode Island Department of Health on this critical issue, which is something we hope to see in all of our public health areas. We have a great summit agenda today. Please keep up the good work, and I hope all of you enjoy the summit and make most of it and continue. Thank you so much.